We are joined today by one of our absolute favorites in our beauty buzz, Dr. Stephen Marsh, who also visits with us every Sunday morning around 8:25 on 3. His office is at Brainerd Place, right in Lyndhurst, my hometown. It's about a mile from Beechwood Place. Easy to find, and he always gives you some information on what's happening in dentistry. Welcome to the show.
Thanks for having me again.
It's always great to see you.
Thank you.
So I was just telling you this. I mean, I think what makes you so super special is that you really develop beautiful relationships with your patients.
Well, thank you. It's very different than the average dental office.
Yes, it is.
We have a wonderful team. The average experience per person is over 30 years. But we sit down just like you and I are sitting down because I get to know people. Teeth are connected to a person. It's important to know what their desires are, what's important to them, and get a sense of their medical history. All those things play into how you should treat a patient.
So there's a bit of a vulnerability there, I would imagine, especially that first visit.
Yeah, I think
right?
it's more than a bit. I can't tell you how many people sit around the table with me. And they've been judged by other practices, other people, and we try to go no judgment. Here's where you are, what do you want to accomplish, and to take that vulnerability away and make it feel like it's a one-on-one, just as we're doing here.
Yeah, you're giving people their smiles back.
Yeah,
that's what you're doing.
Really gratifying for us.
Well, we have numerous pictures to show, so I'm going to let you do the talking because this is your
Be my
artwork,
pleasure. My pleasure. Thank you.
Okay, so befores and afters.
Befores and afters. So this patient, actually, you can see he's my age. He had lost a tooth. One of the teeth was very loose from what we call periodontal disease, and we wanted to show you what he looked like with a bridge. And so in the old days, we used to use metal and porcelain, and it didn't look so great. Today, that's an all porcelain zirconium bridge. It looks wonderful looking up into the mouth. That's how the dentists see him. You can see how we've made things look uniform. And anteriorly, when you look at a front picture, you can see quite a difference between the two.
Oh, that's monumental.
Monumental.
From left to right.
Interesting case here. So this is a young woman. She actually was horsing around with her boyfriend. She fell. Those teeth had actually been made very loose. The oral surgeon saw her, tried to put her back together. She fractured them.
Oh gosh.
And ended up. They tried to save the teeth. Ended up losing them. They lost some of the draw, if you will, and so we actually had to do a porcelain bridge. She's actually in the music industry, and we wanted to give her a beautiful smile. She goes on tour as she's gotten older. That's all porcelain, Holly. We did 6 or 8 units across. We actually used a pink porcelain at the gum because she had lost some bone. So the question is, what do you do in that area? And though you can't see it on this picture, there is pink porcelain to give her the smile, certainly worthy of her and traveling with rock groups all over the world.
That is a model smile right there. And look what you did here.
A woman,
holy cow.
Thanks. A woman, and again, I have a wonderful team and lab. I have to make sure that I point that out. So she came to me right before, 6 weeks before her daughter's wedding. She wore something that went in and out. She hated the way her teeth looked. Didn't like the way the lowers looked as well. And she said, what can we do in 6 weeks? So we proposed doing a porcelain bridge that doesn't have to come in and out. So we use the zirconium material that's beautiful, it shines. And the lower, she wanted to just focus on the upper. We just did some reshaping, Holly, and we did some bonding, a little whitening to give her a beautiful smile. We also raised the tissue, if you can see in the upper, because we want everything to look uniform. And she sent us pictures after the wedding with herself and her husband smiling and said, what a difference.
Oh my goodness, what a wedding gift.
Wedding gift, thank you. And this young man is 19. They had talked about implants. It turned out he didn't have enough bone. So you hear a lot about implants.
Yeah.
He was 19. Mom brought him in. He's about to go to college. He had braces. This is the result. And so we said, let's do some porcelain bridge work on his upper right, and let's do some veneers on the other. Again, we raised that tissue to give him a uniformity. He came back from school. He said everybody loves him. He smiles. He feels confident for the first time in his life. And what a difference, going to college and having something that looks good for all the people that he meets. So he said it was life-changing.
I mean, it's the first thing that people see is your smile.
Yeah,
it
right.
really is. Wow, is there anything you can't do?
Yeah, there are, but in this case, this is really sort of in our ballpark, so to speak.
Those were some amazing results, and I know that you'd probably like to get in touch with Dr. Marsh. So let me get you all the information at home. The number to call is simply 440-461-1003. Again, his offices are located right by Beechwood Mall. You can't miss it there. Brainerd and Cedar, right at that intersection.
Right
ClevelandSmiles.com for more information. Thank you so much for being here today and for everything you do.
Thank you.
Coming up next, our veterans have given so much for us in our country. Find out how a local company is giving to them when we come back.
This segment of Live on Lakeside was sponsored by Dr. Steve Marsh and Cleveland Smiles.